Good Samaritan Children's Hospital needs a new nurse documentation system because the current one is slow. It crashes often and is not compliant with the Joint Commission on the Accreditation of Healthcare Organizations. Additionally, medical staff need to prepare for upcoming federal regulations that pertain to electronic health records. Ken, the nursing informatics director, is in charge of adopting a new informatics system to meet the needs of Good Samaritan Children's Hospital. The project's goals should be one of the earliest steps of any strategic planning operation. The goals will serve as the guides for any future development of the strategic plan. Ken decides the goals should be a system that promotes ease of use, complies with regulations, reduces medical errors, and cuts the time for staff documentation. Research to determine the solutions that may exist in the market or in other institutions. Read the literature first, then consider distribution of a staff survey to understand their needs. Ken examines the literature and researches the health informatics market for systems. He also gives the nurses a questionnaire to see what they need in a new system. After the research phase is complete, the project manager should analyze it. The data collected could be the specifications of different informatics solutions, as well as nurse attitudes toward technology changes in general. Once the data are analyzed and the staff need is recognized, the project manager should begin examining potential solutions. These solutions could include upgrades of hardware and software, simply changing locations of computer terminals. Ken's data analysis indicates that, in addition to the goals he has, several nurses would like to have the system be a touchscreen format. Ken identifies 3 systems that could meet the needs of GSCH. NurseDoc is a system that is entirely touchscreen and has voice recognition capability, but it has the highest rate of error of any of the 3, though the rate is not greatly divergent. DocuNurse is a system that has some touchscreen capability, but has easy-to-navigate screens and drop-down menus and is almost as error-free as the next system. Document is a system that has no touchscreen capability, but has been shown over the course of 5 years to have the lowest error rate of any system on the market. Once solutions have been found, the project manager should then analyze each, keeping in mind the project's stated goals. If the institution needs to seek outside assistance, the institution can issue a request for proposal, RFP, from vendors to find the lowest cost, best solution for the issue at hand. Generally, it is unwise to go with just the lowest bidder without analyzing what that low bid includes. It is a lowest and best standard that should be adopted. Ken drafts a request for proposal, RFP, and sends it to the 3 vendors. He wants to see which one best fits GSCH criteria. The solution that survives the RFP or other process should then be implemented and adopted. The project manager should create a working committee at the institution to adopt the new technology solution. The committee's top priority is developing a timeline for full integration of the new technology. This will give staff members time to adapt to the change and create reasonable expectations for them. NurseDoc is the most expensive. DocuNurse is 10% cheaper than NurseDoc. Document does not have a touchscreen, although it is 25% cheaper than NurseDoc. Ken rates patient safety and touchscreen capabilities higher than the other factors. He decides to go with DocuNurse because it has touchscreen capability and its error rate is not appreciably less than Document. Ken creates a 12-member committee of staff and managers to develop a timeline for the full implementation of DocuNurse at GSCH. They develop a 120-day timeline. One must remember that strategic planning is continuous. Once the solution has been adopted, it should be constantly evaluated to ensure its continued compliance with the stated goals and vision of the institution. The process should include any needed updates and monitoring of regulatory and other requirements that change frequently. This could include benchmarking, which seeks comparisons of things such as staffing, patient satisfaction, and efficiency of other similar institutions.